piloted in this country by King's Fund some years ago, but the time wasn't right. An approach where a public health framework shapes the way primary care is delivered, where not just a focus on the individual seeking treatment in the consulting room, in the surgery, but a concern with a population approach, with partnerships, with working with the local schools and employers and civic society and associations. This is possible. There are models. There are models from Jerusalem. There were models in the epidemiology which needs to underpin that from Will Pickles in the 1930s, from Tudor Hart in recent years in South Wales. And we're seeing it today where I'm working in Cumbria, where this agenda has been embraced with enthusiasm by our local GPs. We await the Public Health White Paper in early January. There is a debate clearly about what is a public health service, what's a public health system. It's my belief that the difference between now and 100 years ago or so was that the Victorian way of doing things was very mechanistic, it was very engineering-based, really. Whereas actually what we are now find ourselves in is a postmodern world of whole system thinking. And I think that if health and well-being based in the health service was to be replaced by well-being and health based in local government, we'd be still in the same fix. We'd be in a fix which is about a domination of thinking it's all about delivering services to people. It's not about mobilizing community, it's not about mobilizing resources, which is why I believe that the public health service needs to sit between the health service and the local authorities, and to work across the whole of the system. I work very closely with the Chief Constable, with the National Park, with the Environment Agency, with all these bodies that have a contribution to make. And I think to embed the public health service in local government would be as big a mistake as it was to take it out of local government in 1974. We have to remind ourselves that health improvement, which is the bit in the National Health Service White Paper that's mentioned, health improvement is one of only 4 strands of public health. The other strands of public health are health protection, and it's seen that that is going to sit within the public health service. But preventive medicine, which in the past, programs for screening, for birth control, for sexually acquired infection, immunization, these kind of programs, which in the past were developed out of local government because general practitioners were not interested in them, but where now there is the potential for developing them in primary care. And then population health care, which is about taking a grip on the quality issues as well as the coverage issues. And I see Walter Holland in the audience who spent a lot of his professional life on these issues. I mean, I've been dealing with problems with breast screening services in Cumbria recently, and you know, these kind of issues have got to be handled by people who know what they're doing, because they're complicated. So the service has 4 wings to it, and we need to be clear about that. There are outstanding questions. I'm drawing to a close, I don't know how I'm doing for time. There are outstanding questions about the discussions in progress. We need clarity now, as soon as possible, on the vision and scope for the public health service. That clarity is not there at the moment. We need that clarity. We need clarity about the central versus the local accountability. If the Secretary of State's going to have a direct line down through the public health service, but the local director of public health has got a foot in 2 camps, doing the splits in this way could be quite dodgy, I think. There needs to be clarity about that. There needs to be clarity about which are the givens from Whitehall and which is the freedoms locally. The Victorians understood that. They worked through enabling legislation, which meant that different places could go at different paces, but they caught up every 10 or 20 years with legislation and so on to require places that hadn't appointed a medical officer of health to appoint a medical officer of health, and so on. They understood that. The boards of health and well-being I see as being absolutely crucial, but we need clarity about that. I think the boards of health and well-being could be the way in which local government is reinvented in this country. We've got such a board in Cumbria. We had a meeting last Friday. It's quite exciting. We were discussing, for example, whether it would be a good idea if they're put on a statutory basis, we could be required to summon the energy providers or the utilities or the transport undertakings to come and explain themselves at the Board of Health and Wellbeing for the impact of their policies and their pricing structures on poverty and inequality. So the boards of health and well-being could be really important things. And one might even think, the same way that the current government's thinking about elected police commissioners, that maybe we should have elected health commissioners on the boards of health and well-being. These are thoughts to be worked through. The independent voice for public health, the role that came to be identified with local medical officers of health, we need clarity on this. It was a very important safeguard. We're familiar today with the independent role of the local auditor, who gives an objective, independent account of the accounts and the finances. I would suggest that the local director of public health should have the freedom and protection to do exactly the same on the state of health of the local population. The medical officers of health could not be sacked for saying uncomfortable things. They could only be sacked for incompetence or if they were alcoholic or something like that. You know, we need the same sort of protections for the independent voice. The health bill, which Yvonne referred to, we need to try and make sure that that has a substantive public health component in it that provides a new framework. There hasn't been proper public health legislation in this country since before the Second World War. Spain is currently progressing a new public health bill for the country. We need to look at that. And then the issue of the ring-fenced budget, this needs to be clarified quite quickly because already some local authorities are saying, you know, great, I'll have £500,000 for gritting the roads. I mean, what we need to be thinking about is reminding ourselves of the funds that were created by Barbara Castle for joint working between health and social services. These funds need to be facilitating, they need to be developmental. We need clarity about that. So finally to wrap up, I would say those of us who are old enough to remember will recall the arguments in the 50s and 60s about the tripartite National Health Service. The hospitals over there, general practice, opticians, pharmacists, dentists and so on over there. And the third wing of the NHS was public health in local government. The NHS was in local government then. It was the third wing. And the discussion was about, I suppose, an early silo discussion about those three things, which in part contributed to the reorganisation, the disastrous reorganisation in '74. But what we might be looking at now, if we're not careful, is a new kind of tripartite arrangement. With the GPs over there, with the locality commissioning and the hospitals over there, the local authority health improvement responsibility over there, the public health service sitting somewhere. And this has got to be drawn together. It's got to be drawn together, in my view, by the local boards for health and well-being in the same way that the cross-department committee, which Yvonne referred to, is intended to do that at the national level. So we await the clarity. We must recognise, you know, it's the worst of times, but it could be the best of times. There's an opportunity that comes very rarely to redesign and re-engineer a whole system, which hasn't been the case before. So the question now is, will it be 1848 all over again? Will it be 1948, new beginning? Or will it be another 1974, which we've had to live with now for 36 years? I think all of us in this room need to engage with this agenda immediately and actively, because over the next 3, 6, 9 months, something is going to happen which will shape the arrangements for the next 10, 20, 30 years. So it's really important. And I hope that today the discussions will help to progress that. There are copies of a lecture I gave some years ago on citizenship and health available at the front for everybody afterwards. But thank you very much.
Thank you.